You're listening to the Get Your Gut Together with Dr. Arreola podcast, and I'm your host, Dr. Arreola. I'm a licensed naturopathic doctor with a telemedicine practice who specializes in all things gut health. I created this podcast to provide listeners like you with the information needed to understand how the gut works, how it affects nearly every aspect of your health, and of course, to give you the basics on how you can start improving your gut health today. I'm committed to empowering my listeners and providing you all with the information and the tools you may need to advocate for yourselves, get your gut together, and achieve optimal health. Now let's get the show started. The information provided on this show is not medical advice and is intended for educational purposes only. It is not meant to diagnose or treat any disease or condition. Please consult your healthcare provider before incorporating any of the information provided into your personal care. Hi, everyone, and welcome back to the Get Your Gut Together with Dr. Arreola podcast. As a naturopathic doctor, I have to deal with a lot of people who don't exactly know what it is I do, and therefore make a lot of assumptions. Now, sometimes these assumptions are good, and sometimes not so much. So today, I wanted to clear the air a bit by writing a letter to the public, if you will, about the 8 things most naturopathic doctors want you to know. And I actually can't take credit for this idea. Today's episode was inspired by a good friend of mine, Dr. Emily Castaldi. She's also a naturopathic doctor who focuses on women's health. And while scrolling on social media a couple of weeks back, I saw this post she made that got me oddly excited. It was titled, "The 7 Things Your Naturopathic Doctor Wants You to Know." And the reason it got me so excited because it was so spot on. Now, this may seem a little cheesy, but have you ever heard a song for the first time and the lyrics just really strike a chord? So much so that before the song's even over, you've already decided it's your new favorite? Well, it was kind of like that. And that's because she put into words what so many naturopathic doctors feel and don't always get the chance to say. Even looking at the comments on this post, you can see it was filled with other naturopathic doctors who really resonated with what she had to say. I shared it immediately, and then I, of course, asked her permission to steal the idea for a podcast episode. I made a few adjustments, but overall, it sends the same message. However, if you're interested, I'll link the original post down in the show notes. But without further ado, let's dive into the 8 things most naturopathic doctors want you to know. The first thing we want you to know is that we are, in fact, real doctors, and we have the student loan debt to prove it. No, but all jokes aside, this is a question that majority of NDs get on a regular basis from both well-meaning and not-so-nice people when we explain what we do. Their responses usually being something along the lines of, "Okay, but are you a real doctor?" And what I assume they mean is, are you like the conventional medical doctors that I go see for my yearly physical or that I see on Grey's Anatomy? And the answer is yes and no. So yes, I am a licensed doctor who went to medical school, took board exams, and now has a doctoral degree in the field of naturopathic medicine. But no, I am not a surgeon like the doctors you see on Grey's Anatomy. I think the best way to explain it is that naturopathic doctors are trained as primary care providers, meaning we have the ability and the right to diagnose and treat both acute and chronic medical conditions. We don't have the right to perform open heart surgery, but neither does your regular doctor that you see for an annual checkup. Another misconception is that we're nothing more than energy workers or homeopaths, or that you can become a naturopathic doctor online. And this isn't right either. There is nothing wrong with being an energy worker, like a Reiki master or a homeopath, but this is not synonymous to a naturopathic doctor. Likewise, neither is being a naturopath. So for many years, naturopathic doctors did refer to themselves as naturopaths, but in this day and age, that term is just not protected, meaning literally anyone can call themselves a naturopath. There is no illegality to referring to yourself as a naturopath because it does not imply formal education or licensure. Some practitioners that use this term do have some education in natural medicine, whether it be self-taught or acquired through a certification program. However, their education is not nearly the same as the intensive curriculum to that of a licensed naturopathic doctor. A naturopathic doctor has attended an accredited postgraduate 4-year intensive doctoral program where they are trained in basic and core clinical sciences, including but not limited to anatomy, physiology, biochemistry, pharmacology, botanical medicine, nutrition, and so on. In addition to this, NDs complete about 1,500 hours of clinical internship working directly with patients in a clinical setting and have to pass 2 national standardized licensing exams to become licensed. We are regulated by state-specific licensing bodies and are expected to maintain continuing education credits on a yearly basis. To summarize, licensed naturopathic doctors put in the work and receive the training to rightly refer to themselves as doctors. So, yes, we are real doctors. The second thing we want you to know is that we chose this path because we didn't want the alternative. Many people assume that becoming a naturopathic doctor was the easy way to get into medicine, and that we chose this route because we could not get into conventional allopathic medical school. But this isn't the case at all. The majority of us chose this path because we had identified and personally experienced how flawed the current medical system is, and we wanted to be advocates for change. I obviously can't speak for every single ND on this front, but I can share my personal story. I'll be honest when I say that for years, I had every intention of becoming a conventional medical doctor and did everything I needed to do to get there. My mother is a now retired registered nurse, and I also have a few doctors in my family, so the encouragement was definitely there. I majored in biology and minored in health education. I joined every pre-med club offered at my university. I took the MCAT and got a decent score, and I even began looking at which medical schools I wanted to apply to. Throughout this time, I was working one-on-one with patients either via volunteer work or through internships at my university's health clinic. And I couldn't help but notice that so many of the patients we were working with weren't getting any better. I witnessed the interactions between doctors and patients day in and day out, and it was hard to see so many people leave without answers and with one more prescription in their pocket. Eventually, it became so clear to me that this wasn't what I wanted. And then, of course, there's my own personal experience with the medical system. I experienced firsthand what it was like to be let down time and time again, not getting answers, not feeling cared for, and ultimately feeling hopeless due to the lack of quality care I received. These collective experiences only solidified my feeling that this was not the field for me. And I know this is a similar case for many of my naturopathic colleagues. Now, I think this is a good segue into the next thing that us naturopathic doctors want you to know, and that is, we are not against conventional medicine. It's common for people to pit us against each other and to think that naturopathic doctors are against conventional medicine because we often prefer the all-natural route. But in reality, this couldn't be further from the truth. So yes, our approach to primary care and chronic disease differs greatly from the conventional approach, but we believe that there truly is a time and a place for all forms of medicine. Although a holistic approach to health plays a key role in our treatments, it's generally understood that this approach is not applicable in all situations. So, for example, if I'm in a car accident and I've sustained major injuries, this is not the time or place to ask about my stress management and the regularity of my bowel movements. So please don't take me to a naturopathic doctor. You better believe that I want to be taken to a hospital where doctors and nurses who were trained to treat these injuries are my providers. This is where emergency medicine, surgery, and many other conventional specialties really shine. Health workers in these fields truly are heroes. It's simply not in our training as NDs to provide this type of care, and that's okay. It emphasizes my point that there is a time and a place for different types of medicine. Where naturopathic doctors really shine is in the primary care setting and in the long-term management of chronic disease. So if I am struggling with chronic digestive issues or hormonal imbalances, then yes, I want to see the ND. The ND who is going to evaluate my lifestyle and tell me where I can make changes to reach optimal health. Not necessarily the provider that wants to prescribe me a medication and send me on my way. But the reality is, there is a likely chance that many people are going to need both of these kinds of doctors in their life at some point. So we don't need to choose one over the other. It's about evaluating the situation and determining the best course of action for the patient. The best healthcare model will not only work to integrate all forms of medicine, but also highlight what each one can do for you. That's the dream anyways. Moving on to the fourth thing that most naturopathic doctors want you to know is that we care about our patients deeply. It's honestly impossible not to when you consider the amount of one-on-one time that we spend with each patient. Standard initial visits with a naturopathic doctor last anywhere between 60 to 90 minutes, and that time is 100% one-to-one with the patient. We ask very detailed questions about your life and get a very good sense of who you are as a person in terms of how you spend your day, what you do for work, the stresses in your life, etc. Learning this much information about a person makes it really difficult to not care. We pour our hearts into each case and we individualize our treatment plans to each individual person based on the information that we collect. Probably the most common response I get from patients after they've received a plan from me is, wow, I have never had something so personalized and detailed created just for me. And this feels great because it can take us hours to write a plan for one person. And although it may not be cost effective, we do it because we genuinely want to see you get better. Now, I'm not saying that other kinds of doctors don't want to see their patients improve, but in terms of numbers, when you're seeing 30, 40, or even 50 patients per day and spending less than 10 to 15 minutes talking with each one, the effort put into each case and quality of care is just not quite the same. The fifth thing we want you to know is that we don't judge you, despite all of our health preachiness. In our visits, we ask detailed questions about a person's day-to-day life, like what they eat and drink and how they sleep, etc. And we can visibly see when people feel ashamed of their answers. And I hate that. We're here to help you. And in order to do that, we want to identify where there might be a need for change. But not because we just think that's best, but because we're trying to help you get to a place where you feel good again. And this feeling of shame doesn't just happen with our patients. We see it in our personal lives as well. When I go out with friends or colleagues and we get a bite to eat or have a drink, there's always someone who makes a comment such as, "Don't judge me, doctor," or something along those lines. And I know it's meant as a joke, but I do think that many people think we live in this 100% healthy lifestyle with no room for fun, since we kind of preach about it all day long. But it's also our job, not necessarily who we are as people. Even the best of us know that it's all about balance. And although we talk about health all day long, that doesn't mean that we have certain expectations for those around us. We don't judge our friends, families, or patients for the way they live their lives. We're not perfect either, and we know better than anyone that change is hard. We're all just trying our best, and that looks different for everybody. So our goal is always just to meet you where you're at and go from there. Moving on to the sixth thing we want you to know is that we know the cost to see us is high, or higher than most people want to pay to see their doctor. But a common misconception is that we are more expensive than seeing your conventional medical doctor. Now, in some cases, this could be true, especially if you're seeing a highly specialized ND, such as one who is board certified in oncology and has tons of years of experience. But for the most part, seeing an ND costs roughly the same amount as a normal doctor's visit. The reason it doesn't quite feel that way is that instead of paying it all to the provider directly, you're paying the insurance company, who is then paying the provider. Now, this may not apply to all naturopathic doctors in the US, since many states do allow insurance to cover visits to an ND. But I currently practice in a state where we cannot accept insurance, so I often get this complaint. But unfortunately, this really is out of our hands. State legislation is who decides which kinds of providers can be covered by insurance, and unfortunately, in many states, naturopathic doctors do not yet fall into that category. So us not accepting insurance isn't a greed thing where we're just trying to make the most money as possible. In majority of cases, our hands are tied. A possible silver lining, though, is that many people have FSA or HSA accounts, which we do accept as forms of payment. Now, overall, the cost to see an ND can be difficult to swallow, even for us, because we understand that this really limits who we can see. It's pretty understood that a person has to have a certain level of expendable income in order to comfortably access this form of healthcare, which is not something we're happy about. One alternative I can offer if money is tight and you want to see a naturopathic doctor is to try and find a university clinic. So check online to see if you happen to live in the same state as a naturopathic medical school. And if you do, I would reach out to their university clinic for pricing. These are clinics that are usually run by 3rd and 4th year medical students who are being supervised by licensed naturopathic doctors. Your quality of care is still great, but you are getting it for a fraction of the price, which is usually comparable to a copay that you would expect to pay at your traditional doctor's office. The 7th thing we want you to know is pretty state-specific, in my opinion, and that's that us not accepting insurance is actually a blessing in disguise. This allows for a lot more freedom in the care we provide for you. If you or anyone you know has ever dealt with a chronic health issue, you know that it can be quite the pain to deal with insurance. You often will get denied for testing and other services if the insurance company doesn't find it necessary. And it's frustrating for both you and your doctor. And something a lot of people don't know or aren't aware of is that insurance companies are also the people who indirectly dictate how much time your doctor spends with you. So currently, insurance seems to pay doctors only enough to justify about a 15-minute appointment. So many doctors have made that their standard appointment time. This is why you feel so rushed during your visit. You spend all this time waiting, and then once the doctor comes in, they speed through your concerns like nobody's business. And they almost seem bothered if you have any follow-up questions. This is because they have other people waiting. So you see, not being able to accept insurance actually allows us to spend the time we deem necessary with the patient. We can have thoughtful conversations and address concerns without making our patients feel like they're a bother. Additionally, we can order whatever lab tests we think would help to get us to the bottom of your issues. And not just those bare minimum tests that insurance will approve, but really in-depth ones. Now, I'm not trying to bash insurance entirely. I know it can be a huge lifesaver when it comes to dealing with medical bills. I am simply trying to highlight the small wins that come with paying out of pocket. And last but not least, we have number 8 on our list of things that most naturopathic doctors want you to know. And that is that our treatments are not a quick fix. Many patients, especially those who have never dabbled in the world of natural medicine, are used to quick fixes. They're accustomed to having a problem, taking a pill, and finding relief. So it can be quite the reality check when they begin their treatment protocols and 1, 2, or even 3 weeks go by and they don't feel drastically different. This often leads to people giving up and jumping to the conclusion that natural medicine doesn't work, when in reality, the truth is that true healing takes time. You didn't develop your symptoms overnight, so they likely will not go away in that time frame either. As the saying goes, you cannot walk 10 miles into the forest and expect to find your way back in 3. Now, we certainly have tips and tricks that can help reduce symptoms in the meantime, but these are not actual cures or treatments, but rather they're band-aids, which can help until we get to the root of the problem. But it's only a temporary solution. And in addition to healing taking time, it also takes work. It's often not an easy path, and just like a personal trainer or a tutor, we can't do the work or pilot the journey for you, but we can certainly show you the way. We know that it's hard work and it takes commitment, but we also know that if you stick through it, you'll have those long-lasting results that you've been looking for. And there you have it. As a summary, in today's episode, we talked about the 8 things most naturopathic doctors want you to know. As a quick recap, I'll quickly review each topic that we covered. So, number 1, we are real doctors. Number 2, we chose this form of healthcare. It was not plan B. Number 3, we are not against conventional medicine. We believe there is a time and a place where each form of medicine shines brightest. Number 4, we care so deeply about our patients, and it shows in the work that we do. Number 5, we're not judging you, despite how much we preach about health on the daily. Number 6, we know it's an investment to work with us, and a large part of that is out of our control. Number 7, not accepting insurance is actually a blessing in disguise and can allow us to work in a way that's most favorable to the patient. And lastly, number 8, our treatments are not a quick fix. They take time, but they also provide results. I hope that you found this information helpful, and if you have any questions or comments for me regarding anything I talked about, please leave a comment or shoot me a message, as I would love to hear from you. That brings us to the end of our show today, so thank you so much for tuning in, and I hope you'll join me for the next one.